It's my feel-good breakfast show.
Welcome back. You're tuning into your Feel Good Breakfast Show, Expresso, right here on SABC3. It's a Tuesday, which means we delve into some health discussions. Now, World Hemophilia Day marks its 29th anniversary this year, and it's a day to increase the awareness of the condition of hemophilia and other inherited bleeding disorders. Now, with increasing awareness comes better diagnosis and access to care for millions who remain untreated throughout the world. And here to help us unpack what exactly hemophilia is, please welcome our trusted medical professional, Dr. Darren Green. How are you, my brother?
Good morning. Good.
Morning.
Great.
Good to have you, man.
Very interesting topic, and I feel like we need to start off
Indeed.
with unpacking exactly what is hemophilia and what causes it.
Yeah, so for some people, they'll remember the term from yesteryear, Royal's disease, because this disease was known amongst the royalty, a lot of European royal families.
Oh, really?
Yeah, and the other component of it is Christmas disease, which has nothing to do with the season of Christmas. It's actually named after some of the people that developed the disease first when it was detected. But nevertheless, hemophilia itself is generally an inherited condition where you lack certain clotting factors that are essential in the clotting cascade. In other words, of people having the ability to stop bleeding in the body. Whether you have a small cut, whether you're bleeding from an organ or a muscle, your body needs these clotting factors in a sequence of events to actually make a clot and stop the bleeding. And with hemophilia, obviously you don't have two specific factors. There's hemophilia A and B. Hemophilia as A is where you don't have factor 8, and hemophilia B is where you don't have factor 9.
Okay, so what's the difference between the factors? Is it just degrees of...
Yeah, so to give you an idea, 1 in 4,000 people have hemophilia A. It's a condition specifically that occurs in males because it's an X-linked condition. So females are carriers often of the mutated gene, but they don't develop the disease, obviously, because they're just a carrier and they've got, obviously, 2 X chromosomes. Whereas in males, they have 1 X chromosome, the disease manifests, and they obviously have the symptoms of hemophilia.
So what causes it?
Yeah, so
what brings it about? Yeah.
So obviously the inherited one is obviously genetic. So there's nothing you've done. There's a mutation on the gene locus that results in your body producing too little or even no factor 8 or factor 9, which are crucial in the entire sequence of that cascade that I spoke about in forming clots and thrombin.
Sure.
And when it comes to the symptoms, I know you said you're missing those blood clotting factors.
Yep.
So what are the other symptoms that to look?
100%. So if your blood can't clot, you bleed. And you could bleed in different places, all sorts of places. You can bleed into your urine, where you have hematuria. You can bleed into your joints.
Without having some sort of
without even having trauma.
Sure.
Spontaneous bleeding, just because your blood, obviously, if there's really too little of it, mild conditions, you won't bleed spontaneously. But if you've got severe hemophilia and the levels are very low, you could bleed spontaneously into the elbow joints, knee joints, ankle joints. You could even bleed into the skin, ecchymosis it's called, into the muscles where you get hematomas, and then even into the brain. So stroke, obviously, is a high risk as well for this group. So you could develop these symptoms and signs if your hemophilia is not managed adequately.
Absolutely. Now, listen, our lines are open if you want to ask any questions. Hemophilia, that's what we're talking about as well. 021-430-9881. Give us a call. You may remain anonymous, should you wish. You mentioned bleeding under the skin, causing bruising.
Yes, a lot of people have that.
Is it dangerous?
Yeah, so it would depend on the size of the bleed and where the bleed is. That gives you an indication, obviously, as to whether there could be chronic knock-on effects. Like if there's a big hematoma, for example, it could cause pressure in a compartment, like pressure in the brain, for example, and then, result on nerve damage and secondary structures being affected. But generally, skin bleeds you see often as a result of either platelet dysfunction, platelet shortage in certain conditions, and also secondary to certain medications, like blood thinners that people are on, like warfarin, like Ecotrin, like things, things like that.
Is it a simple, test you go and do by the doctor, or how do they diagnose you?
It's actually not that simple. Well, there is a blood test that can be done, like a partial thromboplastin time. The general blood clotting tests obviously pick up certain factors in the pathway that I described. But to pick up factor 8 and 9, there's specific subtests that need to be done, and yes, it can be done and tested for. Often the clinical symptoms of having a tooth extracted and you're just taking long to clot and constantly bleeding leads to you being referred to your doctor, your GP, or hematologist to help you get to the bottom of why can't I stop bleeding, you know. So.
Sure, there's definitely a lot to talk about. That's our medical discussion this morning with Dr. Darren Green. Please call us 021-430-9881. We are talking about hemophilia and what it means and how you can treat it as well. We will be back with a good doc in just a bit.
It's my feel-good breakfast show.
Welcome back. You're tuning into your Feel Good Breakfast Show Expresso right here on SABC3. Still sitting down with Dr. Darren Green this morning for our medical discussion. It is about World Hemophilia Day, a blood disorder. If you have any questions around this topic, please call us 021-430-9881. So we ran through some of the causes, what are the kind of signs present themselves with. How common is hemophilia with regards to, if you take a look at the general population?
Yeah, so I'd say for hemophilia A, which is the factor 8 deficiency, about 1 in 4,000. And then hemophilia B, which is also known as Christmas disease, about 1 in 20,000. And it's a disease that manifests in males predominantly.
Why is that? I know we spoke about it. So you say it's mainly men, or is it then really men between the two different ones?
Because of the fact that the mutation and the link is X-linked, what happens is women have 2 X chromosomes, so they can have then obviously one with the defective mutation, and the other X chromosome obviously carries normal expression. So that's why they don't necessarily have to have the disease. Whereas in males, we only have 1 X chromosome. So you have the clinical symptoms and the manifestation of that mutation immediately.
Yeah. We mentioned in terms of, finding out if you do suffer from hemophilia, you mentioned tooth extraction that, doesn't stop bleeding. Is there any other way that you could find out, or do you have to physically go through something like trauma like that to figure it out?
Yeah, sometimes there's like spontaneous bleeds where you'll just have the tendency, without bumping your leg, for example, you'll see blue marks.
Yeah.
Looking at your skin, for example, you'll just see, obviously some underlying skin, fine hemorrhages. If you have a small cut, for example, like we had just before that, it takes so long to actually stop bleeding and to actually clot. Yeah. All those things are signs. Like nosebleeds is another big one. So nosebleeds that you really struggle to get under control is a very, very big red flag.
Is this something that develops, or is it something like you can literally wake up one morning and then all of a sudden you notice some symptoms? Or how does it work with hemophilia really? Because if it's in you and you have that gene, you have that strain, surely it's there, but does it progress? Does it get worse?
Good question. So how it works is it's classified according to the degree of your lack of the factor. So let's say hemophilia A, factor 8. If you have a mild deficiency, let's say you've got 80% of what you should have, you might not have any symptoms. If you've only got 10% or 5% of what you actually should have, you might have then even spontaneous, obviously, hemorrhages. But if you have a moderate case, then obviously you'd only see it when you have a bruise or a bump where it's excessive. Like people, for example, that play rugby or contact sport will have an excessive degree of bleeding from a normal lummy or hematoma, compared to someone that doesn't because of the condition. So that's how you'd know.
And is hemophilia linked to age?
No, so you're born with it. So you have the inability to produce factor 8 from a from birth, really.
Wow. Is there any other types of blood diseases now that we are speaking about hemophilia?
Yeah, when it comes to clotting, it's amazing how your body actually is geared to handle any form of when the integrity of the skin is broken or blood vessel is slashed and so forth, and how it does that. There are other conditions that involve the platelets, where you have platelets shortages. There are hundreds of factors. If you think about this factor 2, 7, 9, 11. We're just speaking about 8 and 9, the conditions that affect the different pathways of the clotting cascade. So von Willebrand's disease is another one that's also well known, that is often linked and called pseudo-hemophilia.
Pseudo-hemophilia, okay. With regards to, people that might be worried going forward, if they have a cut, but is it worth taking a look at maybe some medications that you are taking? Can medications also influence the way your blood operates? And immediately, if you jump onto Google, you'll immediately find the worst results. You know what I'm saying?
Always. So the things that thin your blood, what are the things practically in our day-to-day lives? Well, the first one is alcohol.
Okay.
Alcohol is a vasodilator, and obviously that's why people bleed when they've been drinking a lot, if they have a small cut, for example. Medications, things like anticoagulations, medications like aspirin, for example, clopidogrel, warfarin, heparin, all those things are well-known blood thinners as such. So you'd be very, very careful with the use of that in a hemophilia patient as well. And then obviously secondary effects of other medications. Looking also at the type of lifestyle you live in terms of contact sport. You shouldn't be playing contact sport if you have hemophilia because you're predisposing yourself to knocks and blunt trauma and then bleeding into the joints, into the muscles and soft tissues, etc.
And I wanted to specifically ask you that question because I know a lot of people jump to conclusions very quickly. You know, maybe they are on certain medications, maybe your lifestyle isn't the healthiest at all with regards to alcohol use, and you might think that you are bleeding excessively, but it's just your lifestyle. But it is worth getting it diagnosed as well. We will continue with this topic. We are talking about hemophilia this morning, hemophilia disorder. If you have any questions for Dr. Darren Green, please call us 0214309881.
It's my feel-good breakfast show.
All right, so we are back with Dr. Darren Green for our last topic of this morning, or last health discussion on your Tuesday, talking about hemophilia. Once again, if you have any comments or questions, 0214309881, that's the question. Dr. Darren, once again, thank you very much for joining us and always imparting some very wise knowledge with us.
Thank you.
Okay, cool. So we're speaking about hemophilia. We spoke a lot about what it is, the different kind of categories that you can put it in, medications that can thin your blood. There's so many factors as well. First and foremost, I think for this one, what is acquired hemophilia? I mean, there's that term that I've heard.
Yeah, so the word acquired means you acquire it, you develop it. You're not born with it, with the problem.
Okay.
So in this case, you'll have hemophilia, which is factor 8 and 9, shortages due to other causes, not genetic causes.
Not genetic, because
so
largely we spoke about the fact that it's genetic.
correct. The X-linked thing, the predominance in males, etc.
Yeah.
So acquired would mean it's secondary to other conditions, and one of them is typically something like liver disease, severe liver disease. And why? Because the liver is the factory that manufactures and makes the clotting factors.
Yeah.
So if the liver is sick, it can't perform that function, and thus you won't be able to make clotting factors for the clotting cascade that I discussed. Other medical conditions, autoimmune conditions, pregnancy itself, cancer, and things like multiple sclerosis, also very strong association with their condition as acquired hemophilia, because the body makes antibodies that basically then gobble up and eat up your own clotting factor.
Sure, okay. So that's acquired hemophilia. We spoke about it briefly, but maybe for people who's just tuning in right now and hearing the tail end of the discussion, how is it diagnosed?
Yeah, so bottom line is the history is very important. So we'll speak to you a lot about spontaneous bleeding areas. So bruising, if you bruise easily, or if you see bruising without even trauma or blunt trauma or knocks against tables or chairs, it's something to think about. Swelling of the joints, specifically the elbow joints, knee joints, and ankle joints. You could have spontaneous bleeding into the joints and the muscles. Remember, blood in the urine, that's also another one. And then procedures, a simple cut that just doesn't want to stop bleeding, and nosebleeds. Yeah, nosebleeds, and then the big one, obviously, the dental extractions in the dentist chair. He has real difficulty, he or she has difficulty in controlling that bleeding.
All right. We do have a caller on the line. Marsha, good morning, Marsha.
Good morning.
Good morning, Marsha. What is your question or your comment?
I'd like to ask Dr. Green, is hemophilia related at all to deep vein thrombosis?
Oh, good question, good question.
Okay, is it related all to deep vein thrombosis?
Yes, so they're like opposite sides of the spectrum, because hemophilia is a bleeding disorder where you can't clot, and deep venous thrombosis is where you have a clot, the ability to form clots that block the blood vessels and then clot, obviously, the venous system, and it can return to the heart, affect the lungs, etc. So they're very opposite sides of the spectrum. So hemophilia, thin blood, all right, and deep venous thrombosis is thick blood.
All right, there we go. Marsha, thank you very much. I hope that answered your question. Last but not least, in terms of management, once you have been diagnosed with hemophilia, what's the kind of lifestyle that we can look at? Does it affect your life expectancy in any way?
It will only affect your life expectancy if you don't manage the condition. So if you don't know you've got hemophilia, it could be quite dangerous. You'd play contact sport, you might bump your head and then have a hemorrhage in your brain or and so forth, and then surmise and die from that. But if you know that you've got the condition and you want to manage it adequately, the lifestyle factors I mentioned in terms of knowing what you eat can affect the viscosity, the thinness or thickness of blood, for example. Having cranberry juice and things like broccoli affect the thinness of blood and the working of other medications. Taking medication that thins the blood, like aspirin and other anticoagulants, you need to know about. And then contact sport is the last one.
Yeah.
Obviously, you shouldn't be playing contact sport because of the increased incidence of massive bleeds.
All right, perfect. Dr. Darren, thank you very much for joining us this morning. Always such a
Fantastic.
pleasure to
Thank
connect
you.
with you. That is our
Thanks, sir.
medical discussion on your Tuesday morning.